calls for all migrant workers to be legalized as army seals off 575 building sites in Bangkok. South African variant was confirmed on Monday as having been detected already in Bangkok, as the country is now at the start of the fourth wave of infections, which one medic at Siriraj Hospital last week predicted could see case numbers above 10,000 per day. Monday saw 5,406 cases announced with 22 deaths. As Thai authorities imposed selective lockdown measures in Bangkok and in 4 southern provinces, the plight of the country's 2 to 3 million migrant workers moves into the spotlight, with 575 building sites secured and sealed by the military, with a crisis erupting over hospital beds on Saturday when migrant workers were refused short-term access. The situation has led one migrant rights activist to call for a simple and blanket amnesty for all illegals in Thailand right now, or what he termed a reset, in order to foster a cooperation and understanding between officials and this mobile population who pose a real and significant challenge to efforts to control an emerging and more serious outbreak. The Thai Prime Minister last Friday made the opening announcement before a series of measures emerged, including a targeted lockdown in Bangkok and adjacent provinces, as well as the sealing off by army and police units of 575 building sites in the capital in an extensive operation to halt the spread of the virus from over 120 clusters identified in the city by Saturday night. The Thai government, over the weekend, moved to address the crisis as what appears to be a fourth wave of the virus emerges, with consistently high daily reported infections and deaths since mid-June, and fears that clusters within construction camps and businesses which use migrant workers are growing. The moves came as, on Saturday, military personnel and armed forces dispersed throughout the capital to secure and seal off 575 construction sites, as well as in 4 adjacent provinces which are home to over 81,000 migrant workers. Top public health official denies discrimination against migrant workers after the sick were dropped off for treatment over a chaotic weekend. The scale of the emergency and the critical nature of it was seen on Saturday night when Dr. Somsak Gaksilp, the Director General of the Department of Medical Services, was forced to deny his under-pressure agency was discriminating against migrant workers after an order was issued preventing their admission to already overstretched hospitals and field hospitals in and around the capital. Reports suggest that several unscrupulous employers had shamefully left ill workers at government care facilities, causing panic and confusion. "I insist the department has no bias against migrant workers," declared Dr. Somsak as he acknowledged the situation. "Hospitalization is available to every nationality, but currently, there are too many COVID-19 patients waiting in the queues. Proper protocols including screening required," the medical official warned that proper protocols must be applied and followed, including planning and screening before patients were admitted to hospital facilities, as otherwise there was the real risk of further infection and chaos which would undermine the already burdened network. Dr. Somsak was among those, over the last few days, who was calling for urgent action to deal with the emerging crisis and critical shortage of hospital beds and ICU treatment facilities. Doctors in Bangkok are making critical medical calls with a shortage of ICU beds and increasing demand, with over 42,000 people currently hospitalized, of which over 1,450 are in a critical state, with nearly 500 requiring ventilators. It emerged over the weekend that as few as 20 ICU beds were available in the public health system in Bangkok, with doctors confirming they are resorting to triage in deciding who to admit to highly sought-after ICU beds. On Monday, the number of infections was 5,406, with a top medic last week warning that infection levels beyond 10,000 per day can be expected, with the Delta variant, B1617, gaining traction. Dr. Nithifut of the Faculty of Medicine, Siriraj Hospital, said that at the current rate of growth, this latest wave could well begin to exceed 4 digits or leave the country's infection rate over 10,000 per day. This indicates just how difficult the situation is right now for doctors, frontline medical staff and those with responsibility for keeping the public health system functioning. Decisive government action over the weekend can still backfire. Reports of people moving out of Bangkok. The decisive action, over the weekend, which some observers say may yet lead to unintended and perverse consequences, sparking an exodus of migrant labor and the public carrying the new Delta variant of the virus from Bangkok, came after comments from the government spokesperson Episome Srisnamson on Friday critical of some migrant workers in the capital for not cooperating with officials. She explained that efforts to impose bubble and seal measures that had worked so well in Samut Sakhon had failed in Bangkok because the migrant workers in the metropolis had consistently defeated the orders and regulations issued by officials. In Samut Sakhon, we had workers and staff stay within their workplaces, observing the seal, and within 28 days the outbreaks ended and the people could return home and resume normal life, she explained. But in Bangkok, the situation in workers' camps, markets and factories is completely different. Bangkok cannot end its clusters within 28 days partly due to the factor of cooperation. Desperate migrant workers living from hand to mouth are forced to ignore public health regulations. Exasperated officials found that many workers simply moved from one closed-down camp to find employment elsewhere, driven by the need to earn a daily living, causing clusters of infection to grow in worksites, factories, markets and in certain areas of the city. On Friday night, the Prime Minister led the announcement of the latest moves which swung into action over the weekend, including Saturday's limited and targeted lockdown measures for Bangkok, which are to take effect from Monday. Unfortunately, the sudden and necessarily without notice moves by the governments, including establishing roadblocks in Bangkok and surrounding provinces, has sparked what officials fear most. That is a panicked exodus from the city, as many workers and residents anticipate further restrictions and public health control measures may ensue. Government gives assurances that there will be no full lockdown of Bangkok as the situation deteriorates. Officials working for the Center for COVID-19 Situation Administration, CCSA, however, have made it clear that a full lockdown of the city has been ruled out due to the consequent economic repercussions, with the government now working with limited financial resources, but also the fear that it will only serve to spread clusters of infection, including the Indian or Delta variant, which is known to be circulating in the construction camps of Bangkok. At the center of these emergency efforts, the Delta variant is 50 to 60% more infectious. Fourth wave threatens to collapse the public health system as PM orders trainee doctors to Bangkok. Medical experts are predicting that the Bangkok Delta variant will almost certainly now emerge as the dominant strain in Thailand, replacing the B1617 or Alpha strain, which triggered and drove the third wave and which led to over 240,000 infections since April and a rise in the number of dead to 1,934 as of Monday. There were 5,406 new infections to open the week, while on Sunday, the country reported 3,995 new cases and 42 deaths, with a rising 7-day average to 3,715 cases. Monday sees South African variant confirmed as having arrived in Bangkok, with 8 cases detected on Monday. The total number of cases in Thailand was 249,853, including 8 cases in Bangkok which have been confirmed as the Beta variant, or the South African version, against which the AstraZeneca vaccine is significantly less effective. On Friday night, the Prime Minister explained that the Ministry of Labour was instituting measures to support the 575 construction sites which have been secured by armed forces and police, including the establishment of food kitchens. He also indicated that workers would be paid 50% of their salary from the government to stay in place. PM has called for public cooperation but cannot rule out further measures, trying to find a balance between protecting public health and the economy. The PM called on the public to cooperate with the government and to again voluntarily limit travel plans. He gave an assurance that there would be no curfew imposed but could not say whether further restriction will follow. People will have less convenience during this period, he warned. We must consider measures carefully so as not to worsen the health situation or the economy, while also speeding up the pace of vaccinations. Further details of the operation were given by the Minister of Labour, Suchat Chomklin, who told reporters that the migrant workers had an incentive to stay within their camps, as if they are caught leaving, they will not be paid by the government. Labour Minister says there will be a compact between construction site workers and officials based on pay. If they stay, they get paid 50%. If they leave, they get no money, he revealed. He said the government was in contact with all business owners and contractors linked with the building industry to explain the plan to control the camps linked with 35% of clusters in the Bangkok metropolis, which also includes clusters in food processing factories and other commercial activities, linked with heavy manual labor, employing a migrant workforce. There are also clusters in key areas, with over 120 being identified by the weekend as public officials scramble to control the outbreak. a nationwide problem with emerging hotspots in Bangkok and the southernmost provinces. While the epicenter of this latest outbreak is in Bangkok, it accounts for not more than 25% of the daily tally, with an emerging outbreak in southern Thailand which also of deep concern for the government, as the South African B1351 variant has been detected and it is feared it may be growing more widespread, although experts suggest that it is the Delta variant from India which will dominate the situation in Thailand before long. It is being reported that the Department of Disease Control at the Ministry of Public Health had come out against a full lockdown of Bangkok, advising the government and the Centre for COVID-19 Situation Administration to focus on shutting down risky businesses and areas of activity which have been identified over the previous month. Targeted lockdown measures in Bangkok. For now, the limited lockdown, imposed on Bangkok on Saturday evening, includes a ban on dining facilities indoors, congregations of more than 20 people, as well as parties and celebrations. It also ordered the early closure of shopping malls. There have been cordons set up in targeted districts and villages in the southern provinces of Pattani, Yala, Narathiwat and Songkhla, as well as similar lockdown provisions as ordered in Bangkok. Details of the security operation to seal workers' camps in Bangkok and other provinces. Given details of the lockdown and security operations which are in place at the 575 worker camps were given on Saturday by Deputy Minister of Defence Jachan Changmongkol and the Permanent Secretary at the Ministry, Nat Interacharoen. A spokesman for the Defence Ministry, Lieutenant General Konchit Tantravanich, confirmed that a security operation had swung into action for Saturday to secure the sites and that this would include testing of all workers and organised treatment for them if found to be suffering from the virus according to accepted protocols. Plight of migrant workers in the kingdom now falls under the spotlight because of the emergency, the government's actions over the weekend, and rising concern about the fate of migrant workers in the capital and surrounding provinces, who are also thought to be accompanied by at least 100,000 family members, has prompted activists to warn of the importance of treating the foreign workers with respect and dignity, not only on the basis of human rights but also as the most effective way to combat the virus threat. It is understood there are between 2 and 3 million migrant workers in Thailand, the vast majority of whom are from Myanmar, followed by Cambodia and Laos. Activist warns that many migrants suffer under an acute language barrier and more needs to be done. Adisongkerd Mongkol works with the Migrant Working Group and says that the government must be mindful of the language barrier for migrant labourers and their inability to communicate and read Thai in efforts to make sure that they have access to medical treatment and vaccination. Not all employers are as irresponsible as those who drop their sick workers off at hospitals over the weekend, with a segment of workers registered under Section 33 of the Social Security Act as employees. However, all are very much dependent on their employers to manage access to health services on their behalf, including paperwork demands. Indeed, the pandemic has so disrupted business that it has been the main factor in driving a large number of migrant workers underground, as their employers have wound down operations. Pandemic is a boom time for human trafficking. Security services have recently disclosed that human trafficking activity has spiked sharply because of the pandemic, especially in cross-border activity with Myanmar. People trafficking kingpin nabbed with 14 million baht in his bank account, which swelled during the pandemic. Mr. Adiso warned that the number of unregistered and illegal migrant workers could be anywhere from 1 million at a minimum up to 2 million. Reports from migrant workers vary, from employers who have managed and organized vaccines for them to some who have been sent to testing centers where the workers have been presented with bills to be paid by themselves for having COVID-19 tests conducted. Calls for a blanket amnesty for all migrants at this time and immunity from law enforcement measures. The complex and dangerous situation on the ground right now with the migrant labor force has led Sompong Sakiwa of the Labor Rights Promotion Network Foundation, LPN, to call on the government to order what he terms a reset for all migrant workers, offering an immediate amnesty from prosecution or action by law enforcement agencies in respect of their immigration status. Mr. Sompong personally believes that the number of illegal migrant workers to be about 1 million in Thailand, and is convinced that each lockdown and measure taken by the government to control the spread of the virus is having the opposite or unintended effect, as these workers are being forced to move and then do so without being detected by authorities out of fear of being incarcerated or prosecuted because of their illegal status. Mr. Sompong says officials don't really care at all about migrant workers during this pandemic, while the government has made moves to allow illegal workers to register and become legal at this time, with over 650,000 coming forward by the deadline earlier this year. Mr. Sompong is calling for a simpler and more sweeping measure taking into account the limited and deprived circumstances of this population. He points out that 90% are paid on a daily basis and must move on when work stops in order to survive. He questions the good faith of the government towards these marginalized people at this time. They are left to face it alone. This is what is happening, but it is not seen. The government doesn't care how the migrant workers struggle in the pandemic, he said.